Hey everybody, Damon Graywell, Senior Operations Manager with Centurion Trucking, here with Gail.
Hi, I'm Gail Neuenhausen. I am the Logistics Manager here at Centurion Trucking and also the co-chair for the employer side of the Occupational Health and Safety Committee.
Yeah, today we actually want to bring you a video about the coronavirus, COVID-19 as well, and to kind of give you some information about what we're doing as a company. I know there's a lot of talk about this out in the media, and probably with your family members, friends. So we wanted to kind of bring you some information so you have a source to go to and understand how this is affecting your job, how this is affecting the way we operate, the way we work. We are an essential services provider when it comes to transporting essential needs across Canada and the USA. So it's imperative that we have an information session that's geared to educate you to ensure that you're able to do your job safely. And that's our main priority from Centurion Trucking, is to make sure that we prioritize your safety. We let you know what resources are available to you. We also want to let you know what this virus is and what you can do to prevent it from spreading to loved ones or family members, or even spreading it to the people that we work with. So Gail's actually probably going to go over and talk about what the virus is and how it spreads.
Yeah. So of course the number one question on everybody's mind right now is, what is COVID-19 or the coronavirus? So simply speaking, the COVID-19 virus is a disease that's caused by the contagious SARS-CoV-2 virus that causes respiratory infection. As you probably know, it started off in China in early December of 2019, and since then it has spread globally at a increasing volume, pretty much day after day. You know, every day you get on in the morning and you turn on the news and you hear about new cases in pretty much every portion of the world. So as you can see, it is spreading quite rapidly, and of course it's now all of our responsibility to do what we can to kind of mitigate the spread of this virus and just limit it as best as possible and keep ourselves and our loved ones safe.
We see drivers as being one of the ones, because you're at most risk when it comes to the type of work that we do. Because you're traveling from place to place, you're at different facilities, picking up, delivering loads, you're using public rest areas, you are on the road, and no matter what situation you encounter, we want to make sure that we practice safe hygiene. So a lot of the protocols that are in place now are changing from what you may have noticed before. Some of the stuff that we're doing, even as a company, is having screening when people come and visit us here in the office. So much like a lot of our shippers and receivers are doing, as well as they have different forms that you'll be required to fill out. So we want to make sure that you're educated about that, even when it comes to safe protocols. So the virus is something that can lay around on surfaces and is transmitted from maybe human to human. And so we want to make sure that you keep that distance. It's recommended right now that you keep that arm length distance, about a meter in length, just so that if any fluids are coming out of someone's mouth or someone is sneezing or coughing, the germs aren't really coming onto you. And again, if you're at a warehouse and you're at a surface level with anything, or you're using public restrooms or public showers, you want to make sure that, if you're touching anything, don't bring it back to your face. Whether it's Lysol wipes or hand sanitizers or different soaps, the company is willing to reimburse any of those expenses for you. So that's something from a company standpoint. We want to make sure that you're not limiting yourself to getting any of the supplies that you need to keep yourself safe. Because again, you have families at home, you have loved ones, there's other people in our communities that we don't want to spread this to. And again, we are the essential service provider that needs to be in business to make sure that we take care of the people in our communities, whether it's bringing the groceries in, whether it's bringing in medications for people. We have to stay healthy enough to be able to do that. Obviously, if you're not feeling well, it's something that we want to hear about. And that's something else that probably Gail will let you know, some of the protocols that we're taking from the company, just to ensure that we're not spreading it amongst ourselves.
Yeah. So really quickly though, I wanted to kind of recap how does this virus spread, or at least according to current information that's been released, how is the spread? So really quickly, it is person-to-person spread. So this is basically between people who are in close contact, as again, like Damon said, within about 6 feet or a meter, and through respiratory droplets produced when an infected person coughs or sneezes. So again, you want to keep your distance if anyone is sick or coughing, sneezing. Just practice keeping your distance at this time. It's probably the best way to go, just all around, no matter whether or not you have questions of whether someone is sick or not, because you really don't know. The incubation period has kind of been determined to be around 14 days. So someone could be sick and spreading the virus on, and you may not even know. So just practice that safe distance. So what is the company doing about it? So we are basically taking our own precautions. We just want to do the best we can to make sure that you're safe, our customers are safe, our vendors are safe, our suppliers are safe, our office employees are safe, everyone. We want to make sure everybody's safe. So part of that is we've issued a driver memo that you guys would have all received in your email. In addition to that, we're going to have you sign a copy of the policy when you come into the office, just to make sure that you understand. We want to make sure that this isn't kind of just going over your head and you're like, yeah, okay, sounds good. We want to make sure you have a full understanding of this, because it is a very serious thing right now. In addition to that, we are going to have for any of the symptoms that might be coming up, if you're starting to experience symptoms, if you're not feeling well, if you've got a fever, if you've got a sniffle or cough, anything like that, we are requesting that you contact your dispatchers immediately. Let them know about your signs and symptoms. Let them know that you're going to go and seek further medical information. Then we request that you call 811, which is the nurse's hotline. They'll be able to kind of direct you on next steps, if you have to come in for testing, or maybe they'll do it over the phone, because I know that a lot of the nurses' hotlines are trying to limit you actually going into doctors just to prevent the spread. So they'll walk you through those next steps. And then at that point, so say you did get COVID-19, at that point, when it has passed and gone through your system, before returning to work, we do require a doctor's note, basically just stating that, he did have COVID-19, it has now passed through his system, and he is no longer contagious. Because, of course, if you did contract the virus, we don't want to bring you back and have you spreading it to other drivers who then are going to have to take additional time off and potentially have, risks associated with that. In addition, if you get sick, you call 811 and they let you know, hey, you don't have COVID. That's awesome, but we're going to want that doctor's note just to confirm it, because he told our dispatchers, hey, I'm not feeling well. We want to confirm, because we don't want to bring you back and you say it's not COVID-19, you got it checked out, and it turns out it was, and now we've spread it to half of our drivers. So that's just going to be really important, just for us to kind of keep a handle on it as best as we can.
On the bright side, we're very fortunate that a lot of our drivers are very healthy. A lot of you guys rarely ever get sick or rarely ever have any issues when you're on the road. We're very fortunate for that. But again, we want to make sure that we're not carrying this virus on to family members or to loved ones again. So we want to make sure we follow those sanitary requirements that we have, and wash those hands, sanitize our work areas, be careful when you're using public facilities. All that information is going to be really important for you, and we want you to share that information, whether it's with your co-drivers, whether it's with anyone that's on the road that you're talking to. But as long as we communicate this to everybody, we're going to be safer as a community, and that's something that's very important to us. Again, we're looking out for you. We want to make sure that whatever you need, we're willing to provide that for you. We're doing that in our office, and just because you guys are on the road and at extreme distances, we can't typically be there with you. So again, we've given you the authorization to get the supplies that you need to be safe.
Yeah. And then, of course, in addition to the driver memo, we also are going to be issuing a statement to customers, vendors, suppliers, basically just kind of outlining what our policies and procedures are going to be going forward with the COVID-19 outbreak. In addition to that, any visitors that are visiting the office are going to be required to fill out a self-declaration. So I've got this right here. This is what it looks like. Basically, it has a statement about what the COVID-19 virus is and the potential implications of coming into a workplace with this virus. It's really simple. We like to keep it nice and short, so it's not going to take up much time, but it's very clear and concise. So there's only 4 questions. So first is, have you returned from any countries listed with the coronavirus within the last 14 days? Yes or no? 2, have you had close contact with or cared for someone that was diagnosed with COVID-19 within the last 14 days? Number 3 is, have you been in close contact with anyone who has traveled within the last 14 days to one of the countries listed, such as South Korea, Italy, Japan, China, Iran, etc.? Have you experienced any cold or flu-like symptoms in the last 14 days to include fever, cough, sore throat, respiratory illness, or difficulty breathing? If anybody answers yes to any of those 4 questions, unfortunately they will be denied access to the office and they'll be requested to contact us via phone or email. And that, at the end of the day, is just to keep everyone safe. If there's any potential that they could have contracted the COVID-19 virus, even if they may not have it, it's just to keep us safe. How can we keep our office workers safe? How do we keep you as drivers safe if you come into the office and somebody comes in who's answered yes to some of these questions? Overall, it's just about keeping everybody safe and keeping us going.
Yeah, importantly, we wanted to make this video just to make sure that we communicate this the best way we can. Even though you received an email, we wanted to put this into a video format just so that you're able to understand it maybe a little bit better. If you're still having difficulty understanding it, please feel free to reach out to dispatch. Feel free to reach out to me. My cell number is in every company policy binder under the emergency contacts. So again, I'm available 24/7 on my cell phone. Come visit us here in the office if you have any questions. Call me. Make sure you have the right information. So again, we want to do whatever we can from our side to ensure your safety and to ensure that we do our job to be socially responsible for the COVID-19 virus.
Yeah, and just wanted to kind of outline as well, do not be surprised if the administration staff do ask you to fill out that self-declaration that we just went over the questions for as well, especially if you potentially have been off for a few weeks, because we don't know if you've been on vacation, have you flown across the world to go visit people at home or anything like that. We want to make sure that we're asking those questions, even if you are an employee or a driver. If you've been away for a little while, don't be surprised if the administration staff do this. Again, it's just to make sure that we're covering all of our bases and doing the best we can to mitigate the spread of this virus.
Yeah. Thank you so much for watching. If you have any questions, again, myself and Gail are available at your disposal. Let us know.
Yeah, thanks very much for watching. Have a good one.